Juno. I think there'll be a slide going up for this next presenter as well. So it's my pleasure to introduce Andy Tan. Dr. Tan's an associate professor of communication at the Annenberg School of Communication at the University of Pennsylvania. His research aims to advance communication science to achieve health equity. And his major theme of his research is to examine inequalities in exposure to tobacco-related marketing and media and message effects among populations that are disproportionately impacted by tobacco use. Most recent work has focused on a community-engaged research design to design this culturally responsive communication interventions to reduce tobacco use among youth and young adults in the SGM community. His work, which is funded by the National Cancer Institute and the FDA, uses a range of quantitative and qualitative methods, including media content, digital photo voice, focus groups, surveys, and experiments. His background includes practicing preventative medicine and conducting health promotion and education programs. Welcome, Andy.
Good morning, everyone, and good afternoon to those who are on the East Coast or elsewhere in the country. I'm just going to share my screen. It should work. Can everyone see this?
Yes, we can. Perfect.
So I'd like to thank the organizers again, Masha, Theo, and the team for inviting me to join this panel today. And I'm really honored to also be able to speak after Dr. Bowen and prior to Dr. Matthews, because both of your work have really inspired and informed a lot of the procedures and protocols that I've utilized for my own research in communication science and tobacco-related health disparities. So I'm just going to move quickly to talk about the studies that I've been working on with my team. I don't have any competing interests to disclose. And I wish to acknowledge the many research participants who shared their precious time with us in the series of projects that we've been working on, my research team, students, collaborators, including Mitch and Juno at the Pride Study and their team, and also our community partners that have really contributed their inputs and expertise along the way. A very brief outline of my talk today. I'll be focusing on a very brief overview of health communication and inequalities as it relates to tobacco-related health disparities. One current project that I'm working on, which is Project Resist, that Mitch as well as Juno are integral partners on, and to leave some time for questions and comments. So we know that tobacco is still the leading preventable cause of cancers, as well as cardiovascular and pulmonary illnesses and deaths in the US and globally. And despite enormous progress in tobacco control in the past 5 decades, we still observe huge gaps in this progress. And this is because vulnerable populations have been largely overlooked in terms of tobacco control efforts that have contributed to progress in the general population, but have there are still multiple vulnerable groups that are disproportionately harmed by tobacco use and its impact. And so one example includes sexual and gender minority populations who have disproportionately high rates of smoking, and yet long-term health outcomes in this group, in this population, remain under research. So to illustrate this, less than 1% of 334 NIH-funded sexual and gender minority research studies in 2016 had focused on tobacco use and health in this population. So we definitely do need a lot more research on effective tobacco control interventions, as illustrated by Dr. Bowen's talk prior to this, to ensure that effective interventions and strategies are available to reduce tobacco-related health disparities. So by tobacco-related health disparities, this is defined as the differences in the patterns, prevention, and treatment of tobacco use, the risk, incidence, morbidity, mortality, and the burden of tobacco-related illness that exist among specific populations in the US, and related differences in the capacity and infrastructure access to resources, and environmental tobacco smoke exposure in specific population groups. By communication inequalities, I define this using the definition from Dr. Viswanath at the Dana-Farber Cancer Institute, which refer to differences among social groups in exposure, information seeking, attention, processing, knowledge, comprehension, or the capacity to take action on health information. And one example is, oops, I'm not seeing the image here. It's okay, let me move on. So one example is this research that my team has conducted in analyzing inequities in tobacco advertising exposure among young adult sexual, racial, and ethnic minorities. And in this research, we found from a national sample of young adult women ages 18 to 24 that bisexual women had reported higher prevalence of encoded exposure to e-cigarette, as well as cigar advertising compared with their heterosexual young adult counterparts. Bisexual women also had higher prevalence of um, e-cigarette ad exposure compared with lesbian women. But when we layer on additional intersections with racial identity, we found that the pattern gets more varied and also complicated. And this is, again, in parallel to the data that Dr. Lorraine Dean, had presented in her first presentation today. So we found that compared with heterosexual,
Oh, I think you got muted, Andy.
can you hear me now?
Yep, you're back. We just
Oh,
lost you for the past 10 seconds or so. That's
oh
all.
dear. I hadn't noticed that. Um, when So I'm just going to share information that layering on racial identities where we see much more heterogeneity in terms of advertising exposure to various tobacco products. And this parallels the intersectionality differences that Dr. Lorraine Dean had presented in her first talk today. So compared with heterosexual white women, we found that heterosexual Black women had higher encoded exposure to cigarette and cigar advertisements. Bisexual Black women had higher exposure to cigarette and cigar advertisements as well, whereas heterosexual women of other races had lower exposure to e-cigarette advertising, and heterosexual Black or heterosexual women of other races and lesbian Black women had lower exposures to smokeless tobacco advertisements. So we see a very complex pattern depending on the tobacco product and also depending on the intersections of sexual orientation as well as race. And similarly, when we analyze tobacco ad exposure at the intersection of sexual orientation and ethnicity, we found that compared with heterosexual non-Hispanic women, bisexual Hispanic women had higher ad exposures to cigarette, e-cigarette, and cigar advertisements. So key takeaways from our research in terms of tobacco ad advertising, bisexual women reported higher exposures to cigarette advertisements, e-cigarette advertisements, and cigar advertisements compared with heterosexual women. And conversely, we did not see similar patterns among gay or bisexual men in comparing their ad exposures to heterosexual men across these tobacco products. So this research shows that there's complex social patterning of exposures to different tobacco product advertisements by sex, sexual orientation, race, and ethnicity. And there is a greater need for scrutiny as well as restrictions of tobacco industry marketing practices that target sexual, racial, and ethnic minority groups. So a second example of communication inequalities is the receipt of tobacco treatment counseling from healthcare providers. In an analysis of the National Health Interview Survey between 2010 and 2015, we reported persistent inequalities in the receipt of cessation advice among young adults, racial and ethnic minorities, and individuals who are from low-income social groups and those who are uninsured. A third example of communication inequalities refer to the differences in um, anti-smoking message effects across social groups. So in one study comparing whether graphic warning labels are perceived as effective across social groups by gender and sexual orientation among a diverse sample of Massachusetts residents from 3 communities, we found that male heterosexuals, lesbian and transgender and non-binary participants reported lower levels of perceived effectiveness across the 9 FDA endorsed graphic warning labels. So together, this framework of analyzing communication inequalities in relation to tobacco-related health disparities provides a useful model to develop and test hypotheses of the role of communication inequalities in influencing tobacco-related health disparities in vulnerable populations. We know that communication inequalities and health disparities do not occur within a vacuum and are further embedded within a broader and complex set of micro, meso, and macro level factors specific to each population that is disproportionately impacted by tobacco use. So for example, considering the LGBTQ plus community, micro level factors may include stress as well as minority stressors unique to the community. Meso level factors include cultural factors such as those measures that indicate identification with the LGBT community, social norms of smoking, alcohol use, and the bar culture. And at the macro level, discriminatory policies or policies that prevent discrimination by sexual orientation, and gender identity. Those are factors that may impact these influences between communication inequalities and tobacco use and health outcomes. So the research theories that have informed my work span media and message effects theories, behavioral change theories, the socio-ecological model, minority stress and resilience factors. And overall, the research objectives of this research is aimed at describing the patterns of communication inequalities among vulnerable populations. Second, analyzing whether these differences matter in terms of um, in terms of whether these factors influence as well as interact to influence health disparities. And the third theme in this research is to develop effective approaches to reduce communication inequalities and ultimately health disparities. As Mitch had mentioned earlier, my team has utilized a mixed methods approach in terms of combining both qualitative as well as quantitative methods. And most recently, we've been using photo voice techniques, interviews, as well as stakeholder engagement and experiments to pursue the various research objectives of this program of research. So I wish to share quickly I'm not sure why the graphics are not showing. I hope this is okay for everyone. This is a current project that I have been really glad to receive funding for, which is called Project Resist. And the title is Increasing Resistance to Tobacco Marketing Among Young Adult Sexual Minority Women Using Inoculation Message Approaches. Our study team comprises members from across the country, and the map is not showing up here for some reason, but suffice to say that we are well represented in terms of partners as well as co-investigators from multiple institutions to represent diverse expertise and inputs. The purpose of the study is to determine the effects of using a culturally tailored inoculation approach to increase resilience to tobacco marketing influences among young adult sexual minority women. And we felt that obtaining stakeholders' critical inputs throughout the project is important to support later adoption and implementation. Our aims are to engage with key stakeholders to optimize the anti-smoking message design and to collect pilot data that will inform future intervention design. In aim 2 of the study, our goal is to evaluate the effects of culturally tailoring anti-smoking messages. And this is where we drew upon much of the research from Dr. Matthews' earlier work. And in aim 3, our goal is to evaluate the effects of using an inoculation message type, as well as analyzing the dose and latency on young adult sexual minority women's resilience to tobacco marketing, smoking, and quitting intentions. So this is a very brief conceptual model that is informing our research, and our overall hypothesis is that utilizing inoculation messages versus health-related messages and combining it with cultural tailoring efforts and strategies will increase, will reduce intentions to smoke among non-smokers and increase intentions to quit among smokers. And this is an overview of our planned research activities. We are currently in year 1 of the project, so we're still very much at the formative message design and evaluation and pre-testing phase. And I would like to share some preliminary findings from our work so far this year with comb through existing literature as well as existing campaigns to extract central arguments within these anti-smoking campaigns. We reviewed over 1,800 unique messages that contain over 800 central arguments against smoking and created draft anti-smoking messages that were reviewed by our external advisory board members for their feedback on each argument. And utilizing this input, we revised and selected 34 messages that were utilized for an argument strength rating study among young adult sexual minority women. And in this study, over 300 participants, half of whom were non-smokers and half were current smokers, were asked to rank 6 different arguments out of the pool of 34 arguments based on perceived effectiveness, the quality, as well as whether they considered themselves as the targeted audience. We also collected open-ended comments about each argument from our participants to provide additional information. So to give you some examples of the arguments that we tested, anti-tobacco industry arguments are what we conceptualize as inoculation messages to try to induce greater resilience and resistance against marketing. And health effects of smoking messages are the tried and tested messages that have been used in existing anti-smoking messages. Our research questions for the argument rating study were to analyze whether perceived argument strength differed by sexual orientation, gender identity, or smoking status, and whether there are interactions between smoking status and sexual orientation in association with their perceived argument strength. And finally, how do participants perceive specific arguments based on their qualitative open-ended comments? And this is the perceived argument strength scale that we utilize to assess the argument strength of each message. And this is a scale that's very frequently utilized in the formative research of anti-smoking and anti-tobacco campaigns. So we found that there were no significant differences in overall perceived argument strength by gender identity, sexual identity, and smoking status, and that there were no significant interactions between smoking status and sexual orientation, which is helpful information for us because it tells us that we don't need to have specific anti-smoking messages tailored for each sexual orientation or gender identity subgroups of young adult women. We did see differences in argument strength rating between messages, and this helped us to further select messages that are considered to be the strongest among the set of the 34 arguments that we tested. So just to give you a flavor of the open-ended comments that we received from this sample, for this particular message, we did see that overall comments were generally positive, and participants thought that this message was thought-provoking, helpful, and well-stated. Although there were some questions in terms of the relation of this message with regards to their own smoking and health. And among the bottom-ranked arguments, we did see comments and messages that helped us to shape the next phase of our message testing process, because there were sort of rejections of certain phrases and terms describing the LGBTQ plus community. And this is really helpful for us to revise and refine our anti-smoking messages for the subsequent phase of this project. So the next steps in this study include generating and testing additional perceived argument, generating and testing additional arguments that utilizes a more positively framed argument. And we will also obtain authentic images among young adult women who identify as LGBTQ plus for creating message concepts. And we will then assess these message concepts using individual cognitive testing interviews and finalize the message stimuli that we'll be using for a national experiment in our second aim of the project. Thank you so much